Hi, Mr. Stu. Hey, I've seen some of your videos and how you talk about children's mental health medications. I had a specific question. I've noticed that ever since my child started their mental health medication, they seem less like themselves, quieter and not as energetic as they used to be. I'm really concerned that the medication might be affecting their personality. Do you think it would be a good idea to take them off the meds? And if so, how should I go about doing it safely? This is a question that I get very often, and I need to preface my answer to this question by saying I am not a licensed psychiatrist. I have very little to do with medication, and as a matter of fact, as far as it goes with prescribing medication or helping alter prescriptions on medication, I have no ability to do any of that. So I'll give you my professional opinion on mental health medication, and then make sure that you discuss with the prescribing doctor any changes that you'd like to make. That's really the first thing. If you decide that you'd like to change anything about the medication you are on or the medication that your child is on, it's really important to talk to the doctor who prescribed the medication. They are the ones with the authority. They are the ones who know much more about the medication than I know, much more than what you know. But you can discuss with them what you're seeing in your child and discuss with them the idea that you think it might be a good idea to come off of the medication, see their thoughts and feelings about that, and then work with them on a plan to move forward. So first and foremost, I am not a doctor, and any changes need to go through your doctor. We know that all mental health medication have side effects. Every single one of them. And really, when you are making the decision to go on medication, you have to decide, do the benefits outweigh these possible side effects? One rule of thumb that I like to use with my clients is that medication is really used for danger, not just discomfort. If it's just that the person is uncomfortable, even if that person is a child, then it's about building their tolerance of that discomfort. If it's some supports that they need, it's about putting those supports in place, not just giving them a pill and thinking that's going to fix the situation, because that's not the case. Giving a pill can a lot of times support a child so that then their brain is prepared to go through some therapy work and to do some other supportive things that are beneficial. But the medication in and of itself is not a fix, and it doesn't make the disorder go away. It doesn't heal. It can just allow the child to not feel that discomfort, or it can help them come out of dangerous situations. In situations where people are wanting to harm themselves or harm other people, medication is a great option, because then it allows their brain to get to a place where they are no longer wanting to harm themselves or harm other people, and they're ready to go through some of that therapeutic work. So those are a lot of things to consider just even before going on medication. Once you're on the medication, it is important to have a conversation with your doctor anytime you see them about the plan to come off of the medication. Just like I said, all mental health meds have side effects. Now, coming off of those meds also will give side effects. There are side effects to coming off of medications, and if you come off of medications in an improper way or in a way that is not facilitated by your doctor, you can actually go into withdrawal from some of those medications, and you can do a lot of things that can create a lot of harm. So make sure you are talking with your doctor often about any changes you're noticing, any side effects that are occurring. Now, in those cases of danger, where the person taking the medicine is actively thinking about harming themselves or harming other people, or it's not just discomfort, but the disorder is creating a situation where they cannot perform their daily living tasks, the things that they have to do on a daily basis, then medication can be really, really helpful. But keep talking with the doctor about how to monitor that medication, any side effects you're seeing, and then with the plan to come off the medication once the other therapeutic work has taken place. If you take all of that in your mind, the number one thing is talk to your doctor. Let them know that you're seeing those changes in your child, that you're seeing the changes in your child's personality, that you're not seeing them behave in the ways that they used to behave, and not in positive ways, but in ways that are concerning. And that you feel that this child is now at a safe place where they can start to back off the medication. And then you and your child's doctor can work together to come up with a plan to reduce or eliminate the medication entirely. And remember, if you are considering going on medication, all of the medicines have side effects for going on, all of the medications have side effects for coming off, and all of the medications have side effects while you are on them. So sometimes you can create a situation where you thought a pill was going to solve this problem. You take the pill, or your child takes the pill, and then it creates more difficulties. So then the doctor will say you need another pill to take away some of those difficulties, but that pill also has side effects. And so then and it can go into this wild, entangled web. Make sure you take the idea of going on to medication very seriously and understand it's not a fix and it's not a solution. It's a support to allow you to achieve the solution. And always talk with your doctor about anything you're seeing and any plan to come off of the medication, but don't just stop it. If you just stop it, you can cause a lot of damage from withdrawal or other side effects that can happen from coming off of the medicine. Hopefully that was helpful. It can be really concerning when you see those changes in your child. Keep the conversation open with your doctor. Talk with them about what you're seeing, and hopefully you and they can come to an agreement about the plan for the child to come off the medication, and make sure that you include the child in that conversation as well.